The biggest thing really was the gap in the language of our community getting the messages on time as the vaccine or as COVID was starting. So it was important that as phase of organizations that we provide services to English limited proficiency community, we advocate for us to get equal access to vaccine opportunity. So we work together with other providers in the community, and we said this is really not rocket science. Let us just find a space. Department of Health, you have the know-how. We know how to bring people in, and let's vaccinate as many people as we can. So that's what I think propelled us, and I'll keep using us because it was a teamwork, right? It was all of us coming together saying, these are the gaps, let us figure out how to fill the gap. But we had to do a lot of advocacy to say we're equally important.
Luis, Weiwei, and myself, we were all kind of part of the Vermont Professionals of Color Network, which doesn't really translate into clinics and healthcare at all. So we found ourselves doing that because there were people who had already started this work before we did, Wichie's group and the group at AALV, but also having like visibility into how the policy is coming down of, okay, we're prioritizing these age groups because we know old people are gonna get sick or harmed the most, but we had data that showed that BIPOC communities in Vermont and across the country were actually getting harmed even more, even when you account for age. So that didn't make sense, and I worked in city government, so I have kind of access to what that looks like and maybe how to change that. We started out with trying to change what the actual law is and getting the state to change what the law is, so we don't have to kind of subvert the law to get our people vaccinated. But then from there, it's okay, if the law is going to change, then how do we actually provide a clinic for people so that they feel like they have all the access they need, whether it's language access or physical transportation or what to do with my kid when I have to go and get this vaccine, or how do I even know if I want this vaccine? Am I comfortable talking to the people who are about to go stick me with a needle? All these things, that's kind of where the clinics came out of, is because the normal kind of state-run clinics were just a very sanitary place. You go in, you do your thing. There's no one there to really consider all these factors that our communities have to consider. So from there, we build out these vaccine clinics that lasted for weeks and weeks and weeks, and actually we still do them now. And we vaccinated like maybe 4,500 people at this point through our clinics alone, and these other clinics have done so much as well. And I'll stop there.
Yeah.
So.
Yeah, and I just want to point out that the AALV clinics have been operating since when? Since well before everyone else started. And I just want to note that because such an important factor is like, this is where really everything kind of jumped off.
Right, and we are still operating we have reduced the number of days because many people have been vaccinated. Now with boosters, we have to continue going. And it's really the support of the community, to some degree now the support of the government for us to be able to do this, because we need funding to do it, right? The city, the state.
And Wichie, what about in Brattleboro?
Yeah, so actually my work with the vaccine clinic, the momentum for it kind of started around the time that you started with the communication stuff. So I was working for Brattleboro Memorial Hospital at the time. I was their data warehouse engineer and architect. And one of the things that was very obvious as we saw the racial disparities across the state is that we actually didn't collect race and ethnicity data here in Vermont. And of course, everyone was saying, especially people of color, like, hey, I'm pretty sure we're disproportionately getting COVID. But they're like, where's the data? So yeah, I'm glad y'all sympathize with that one. So I was part of sort of a coalition off of a collaborative of legislators and nonprofit leaders in the Brattleboro area as a data engineer expert to like be able to convince the state to be able to collect race and ethnicity and work with local hospitals on how we transmit all of that data in a way that's fast and effective. And just a note, to this day, actually, I may be wrong, maybe this year it changed, but as of last year, Mayo Clinic actually does not transmit ethnicity data. Their reasoning because they're not mandated to. Just putting that out there. I had done with all that work, and then of course we heard a lot about the communications work that was happening with AALV, and at the time I was part of the Racial Equity Task Force under Susana Davis and a few others of us, and definitely helped push for the recognition that more than English is spoken in Vermont, and making sure that we continuously, as our information gets out, that it needs to be available and accessible, and part of that is language. So the race data comes out, obviously, the disparities, oh, surprise. And then ALV and Dr. Mercedes Avila was on Racial Equity Task Force with me, and I learned about the clinics that were being available to households where there was both a BIPOC person and a person that had, that fit one of the categories at the time, whether it was like age or other things. A lot happened in that year. And so that's sort of like how we came up with the idea down in southern Vermont, specifically Windham County, on like just getting people in. And I talked to the NAACP at Windham County to see how this was possible. We talked with legal experts on how to do it in a way that's legal. And then the things that I sort of learned from Racial Equity Task Force, from the hospital and from your clinics, was like, what we need is, we don't need to set up barriers. What we need is you to just come in and get your vaccine. Doesn't matter who you are, doesn't matter if you have documentation or not. In fact, you don't even have to give us your real name. Just come in, get a vaccine, right? And being able to do that. But at the time, of course, you had the whole, you have to be BIPOC, in a BIPOC household, and you need to meet one of the other qualifications. And just a shout out to Luis, who was in a meeting with me and a bunch of other folks, with, at the time, Deputy Commissioner Tracy Dolan, where they were at, the Department of Health was asking us, what's your, like, what do you need from us? And we're like, it is difficult to explain to people, especially people who don't have necessarily English as a first language, or have like government hesitance, to be like, here are all the ways that you need to qualify to be able to come to this vaccine. And it was just, I was spending hours talking to people, explaining how the census got created to understand what BIPOC means. It was like, it was so convoluted. I'm just like, can we just say, if you identify as a person of color, just come in. When that happened, then it's like when everything started happening. I was able to contact Tokia in Rutland, and Patty Johnson in Bennington, and we were able to get money from the Health Equity Community Engagement Team. Big shout out to them, and partner with over 30 organizations across southern Vermont to be able to vaccinate over 1,100 BIPOC family members.
Yeah, cool. I mean, I think the overarching takeaway from right now is the lack of access for the BIPOC community is ridiculous, right? So there's already hesitancy because of historical reasons, all these issues, and then also just the lack of access to what everyone has been saying, like that language access piece, all that, and these partnerships are really important. The fact that everyone was able to communicate from Thato all the way on down, that this is an important thing that we have to do in order to make sure that the community is being served. This is kind of going off script, can we talk about those partnerships a little bit? Because I think those are a really important factor to what we're talking about. Anyone can go.
Sure. I think partnerships are crucial to what we do. We have a saying in my culture, I come from Botswana, that you cannot be successful, I don't know how to quite say it in English, being alone. We come from communal communities where we make decisions together. We get the information. We may not necessarily agree on the information, but we sort through stuff, and that's the culture that we bring here, right? So the ability to come together and say we have one common interest, and to ensure that we are all safe as a community, to ensure that our communities understand the impacts of the vaccine because of the historical issues. Doing that as a front, as one as coming together as partners is very crucial because one, Vermont is very small, such a small state, right? And then our ability to work together to provide such crucial services, we cannot argue with that. And partnership strengthens us. The reality of our organizations, we are not as well funded as most organizations. So it increases our capacity to do more than what we could do as a single organization. So, and then we also built the camaraderie. Is that the word? I can never pronounce that word. Whatever that word is, and we work together really to serve. I think we can all agree that our vocation is to serve the community, right? So that's one powerful thing that I think we have if we come together to do the work that we all do, and it's such crucial work.